Greetings to my professional colleagues with the National Association of Pediatric Nurse Practitioners. I am Dr. Jessica Peck, and I am honored to serve as your virtual president for this unprecedented time. And as we approach March and conference time, and we eagerly anticipate the 42nd National Conference on Pediatric Health Care, I eagerly look into my COVID crystal ball to see if I can see future predictions. But as it has been for the last year, all signs are still elusive and quite unpredictable. Conference really always feels like homecoming for this professional home of pediatric-focused advanced practice registered nurses. It's a time where we eagerly greet old friends and join the adventure to create new connections with new colleagues or students or new members. It's a time where we feel a sense of pride and purpose as we attend sessions, knowing we're getting the best education from the best pediatric nursing leaders in the country. In fact, one year I was stopped while walking in the hallway by an attendee who said, "Are you in charge here?" At the time, I was really not in charge of anything, and I was puzzled, and I said, "No, I'm not in charge." And they said, "Oh, well, you were walking like you were in charge." Maybe it came across that way, but I confess to leaving our conference feeling invigorated and equipped for impactful work. And I'm always inspired to respond skillfully to the precious children who present for my care. And although we can't be together in Orlando, I know that I will see many of you at the virtual conference, and it is going to be, I hope, a record-breaking number. And what I do know is that all of you caring for children across the country are a trusted authority and indispensable resource serving to optimize child and family health. So let's talk about conference. If you have not registered yet, which maybe you're thinking it's virtual, I don't have to make any travel plans or hotel arrangements, and I can do it at, a little bit later, you need to register by March 19th to reserve your spot. So we are going to have more than 80 sessions. This is an extraordinary opportunity for you because when we go to conference in person, you always have to pick and choose. And you have no opportunity to hear those sessions that you miss, except if you're meeting your colleague for a drink over in the evening and you are able to share the sessions that you each attended that day. But you will have all access to all 80 sessions through July 31st. That is an extraordinary value. The other thing that you need to know about this conference is that it is not your typical virtual conference. We've had more than a year now to think about this and to plan for this, and this is going to be really the next best thing to being together in person. But we are pulling out all the bells and whistles and all the stops for you, and so we hope that you will join us and invite a friend to join you as well. Join virtually and join us for that conference. Now, speaking of conference, we always have a little bit of fun at conference. And this conference is no exception. So we're not having an 80s dance party, Kathy Hout, if you're listening out there, but we are going to have a trivia night. So this will be a fun event on Wednesday, March 24th at 7 p.m. Eastern Time. And proceeds to this are going to benefit the NAPNAP Foundation and NAPNAP Partners for Vulnerable Youth. So it's just a very small cost. You can add it onto your conference. If you've already registered, you can go in there and add it to your registration. Or if you haven't registered yet, we would love to have you join us for that fun trivia night after a day of learning to benefit the work of the foundation and NAPNAP Partners. Also, in line with virtual meetings, we will have our annual business meeting on Tuesday night, March 16th at 6 p.m. at Central Time, 7 p.m. Eastern Time via Zoom. We did our annual business meeting last year by Zoom, and it was quite successful. It's not the same as breakfast with colleagues, but you can bring your breakfast and have it virtually with us. And at the nighttime, who doesn't love breakfast for dinner? And we can reminisce about old times while we talk about new business. Another important thing to know about is that it is election season and it's time to vote. So by now you should have received an election notice from our independent election company, Yes Elections, formerly Elections America. And if you didn't receive a notice, then we want to hear from you. So you can email napnaphelp@election-america.com. That's napnaphelp@election-america.com. Your vote is really important, and we need you to vote by March 31st. That's when the election closes. Another exciting thing that we have going on at NAPNAP is the development of core competencies for health professionals to deal with human trafficking. As you know, NAPNAP partners for vulnerable youth and the Alliance for Children in Trafficking, with a special thanks to Chair Dr. Teresa Zielinski and Co-Chair Dr. Brenda Cassidy, who are currently leading that initiative. NAPNAP has been a forefront not only in the nursing arena of trafficking response, but in the child health arena of trafficking response. But also, we have just been a national and now international leader in stopping human trafficking. So this has been a 3-year project that I've actually worked on with also Dr. Chaka Batley, and we were the nursing representatives for 4 disciplines. We had medicine, nursing, we had social work, and also mental behavioral health. These were published by the United States Department of Health and Human Services and the Office of Trafficking in Persons. They're available on our website. You can find them in our news release. You can find them at napnappartners.org. But it helps equip individuals, healthcare organizations, as well as academic institutions for what are the core competencies. What do you need to do to be able to respond to trafficking in a skilled way? So make sure that you check those out. It's really exciting that our name is co-branded on there with the Department of Health and Human Services, with Heal Trafficking, with the International Center for Missing and Exploited Children. So the other exciting thing we have going on, if you haven't joined us yet for Team Peds Talks, our podcast, we would love to have you listen in. Our first series ended with about almost 4,500 listens from, I think, 14 different countries from around the world, which is really exciting. And our second series is focused on mental health. Now, you may be thinking, I'm acute care. Is this going to be applicable to me? And we've been very conscious about that, and we are covering some acute care topics of mental health, including hospitalized persons with eating disorders and other elements of inpatient or intensive care. So, but everybody is talking about child mental health, and we recognize our responsibility to be a thought and conversation leader in this area. And so it airs every Tuesday. You can find it on Apple, Google, Spotify. You can find it on PCE on napnap.org. And every Tuesday we have a new episode for you. For this series, we are covering topics such as online aggression, electronic aggression, which includes cyberstalking, cyberbullying, trolling, catfishing, outing, flaming, and all these other words that we're trying to learn. We're talking about anxiety and depression, about school stressors, about managing ADHD through telehealth and in-school and online school environments. We're talking about substance use. We're talking about eating disorders. We're talking about all things mental health. So make sure you find us at Team Peds Talks and give us a listen, share it with a friend. This series is also very friendly to parents. So we invite parents in for a kind of backstage look at what we are doing as pediatric healthcare providers across the country to effectively respond to mental health. We're trying to demystify the mental health care process, destigmatize it, and tell them what it will look like when they come in for treatment. So would love to have you listen in on that. We are also doing a survey on how the pandemic has impacted you. We really, really want to hear from you. We want to hear how this has impacted you emotionally, professionally, financially. We want to know because we feel like as pediatric focused advanced practice nurses, we have a unique voice in this space to speak up on how the world has changed for children since the pandemic. So make sure that it only takes about 10 minutes, and you can find that in your email, or you can find that on napnap.org or on our social media, on our Facebook page or Twitter. So we'd love to hear from you about that. Also, the Journal of Pediatric Health Care is having a special issue on planetary health, and they have a call for issues going out. This will be for the January-February 2022 issues. This is going to be guest edited by our very own Dr. Mary Chesney and Dr. Karen Duderstadt. They are willing to help mentor new authors. So if you have a great topic that would make a wonderful manuscript for planetary health, then make sure you look at that call. The other thing we have going on is Connect and Recruit. So it's time to recruit your colleagues to be a member of NAPNAP so they can have these amazing benefits and be a part of all that we are doing to influence child health. So I would encourage you to do that. If they put your name in the referral, you can earn a discount on your own membership. And we would love to have more people join us as experts in pediatrics and advocates for children. Again, this is a very extraordinarily trying time, and it is going to be very therapeutic for us all to come together, even if that is a virtual online environment, to share our experiences and to be able to seek encouragement from each other as we all continue to work to positively impact child health across the country. I hope that you will join us for the virtual conference. If you have any questions, feel free to reach out to me. You can reach me on Open Forum, or you can email me. You can find my email on the NAPNAP website. I would love to hear from you about how you are doing, how you are being impacted. Know that you are not alone. You have over 8,000 colleagues who are here cheering you on, supporting you, and hoping for your success as we continue, again, as experts in pediatrics and advocates for children at the National Association of Pediatric Nurse Practitioners. Be safe and be well.